Hey, this is my exam 1 practical video B, part B, which is going to be testing ankle joint stability, and I'm Bradley here as my lucky patient. So the first test I'm going to do is the anterior drawer sign test, and Bradley's already in position, thankfully, where his involved leg is hanging over the edge, relaxed, nice and relaxed. I'm going to grab the heel with the palm of one of my hands, and then with the other hand, I'm going to grab the tibia, and then I'm going to push the tibia backwards and push the heel forwards, and just like so, like this. And if the foot glides, then that's a positive test, and that means that, or if there's clunking, or at the very end point of the motion, then that could be a positive sign as well. And it's an injury to the ATFL, anterior talofibular ligament. So the next test that I'm going to do is the Kleiger's test, and this one you're going to have the patient with the involved leg hanging on the side of the table as well. You're going to stabilize the lower leg like so, and you're going to rotate the foot laterally. If there's pain on the medial side, then that's indicative of a deltoid ligament injury. And if there's pain on the outside or laterally, that's indicative of syndesmosis injury. And then next I'm going to do talar tilt. So inversion talar tilt and eversion talar tilt are kind of the same thing. Not the same thing, but I'm just saying like in the same realm, so I'm going to do them together. So you're going to stabilize the lower leg. You're going to have the foot at 90 degrees, and you're going to rotate, so you're grabbing onto the calcaneus, and you're going to rotate. For inversion talar tilt, you're going to rotate inwards. If there's excessive motion of the talus, then that's going to be a positive test, and that could be indicative of a calcaneofibular ligament injury, or it may also indicate an injury to the PTFL and ATFL, which is posterior and anterior talofibular ligaments. And then same thing for eversion. You're going to have the foot at a 90-degree angle, and then you're going to, except this time you're going to rotate the calcaneus, evert it. You're going to evert it. And if there's excessive motion of the talus, then that's indicative of positive, and it could be an injury to the deltoid ligaments. And then the last test, I'm going to have him scooch up on the table a little bit, is the medial subtalar tilt test. I'm going to stabilize a neutral talus, and I'm going to hold on to the calcaneus, and I'm going to move it medially, like so. And if there's excessive motion of that talus again, then that's indicative of that's a positive test and indicative of an injury to one of those lateral ligaments of the ankle.